Hey, I'm Jess Carter, and on this episode of Data Driven Leadership, we're going to take a closer look at the efficacy of data in the healthcare industry. More specifically, we're exploring the potential of data to drive phenomenal patient experience from square one. To help me solution on the spot is Michael Schwarz, our Senior Vice President of Professional Services at Resultant. Welcome, Michael.
Hey, thanks, Jess. It's great to be here today. Look forward to our
Awesome.
topics. Yeah,
How are you doing?
I'm doing great. Thank you.
Good. So for people who see and hear your title, Senior Vice President of Professional Services in a consulting firm, they may not think, oh, healthcare. Can you say just a quick snippet of your experience in healthcare?
Yeah, real quickly. I really enjoy working with all of our consultants that we have here at Resultant and over professional services. We service a number of different industries, and healthcare just ends up at a lot of the outcomes-focused work that we end up working on. And I came here by way of working in the healthcare space. So I spent a number of years on the facility side working within health systems to look for operational efficiencies, to help predict the length of stay and readmission that inpatients may have as part of their experience, and really just understanding how stressful it can be to go into a hospital or to go into a doctor's office where you're really waiting on a diagnosis and a solution to your problem. And when you think about the patient and all of those emotions that go with it, you can start to pinpoint improvements all along that operational part of the experience to help make improvements and to lower stress and to just create a better outcome for your community.
I'm sure many of us can relate to that, points where we've been either on the receiving end or walking in to support a loved one, right? And so super, and especially in the last few years, right? Just more important than ever, and a whole bunch of exposure to that.
With that as well, Jess, I mean, so many aren't even able to even come into the hospital. There's been interactions like we're having right here. And how do we streamline that and make sure that it connects to a record that, if you do end up face to face again, that it's just, we provide continuity and that experience does become just one holistic, experience for the patient, but also helps their health looking at all those different elements.
It's awesome. Okay, so we are going to go ahead and take on this solution on the spot challenge. Are you ready?
Let's do it.
All right. So we're in this together. Let's say that we get a call from a new CDO, Chief Data Officer of a healthcare facility. They want a thought partner from us to explore where to begin building the organizational's maturity around how to drive phenomenal patient outcomes using the data they have at their disposal. They share that they know the industry, they understand the familiarity of data insights and signals that are changing, in a moment's notice in the industry. They're trying to respond rapidly. They feel like they can't keep up, and they're trying to figure out where to begin. Where do you start charging towards a data-driven phenomenal patient outcome result? And is it your pipeline, your quality, your, client experience data? How do you begin? Where do you start? So that's our solution on the spot challenge for today.
We're going a lot of places with that one. So let's think through that. There's certain parts of an interaction within a facility in a doctor's office that you would expect and have been around for a while, and there's different levels of maturity. That is, welcoming a patient, that is looking up a record, that is documenting the experience and what the physicians and clinicians see and hear with the patient. And those have been around a while. And there will always be improvements on the clinical side. What I would do as the CDO is go in and be a patient for a day. How does that experience look, right? So how did they create an appointment? How long did it take to create an appointment? Did they get to see their preferred physician? If they're coming from a different system or a different doctor, did those records make it in to the conversation, or are we starting from scratch in that first interaction? Getting into the facility, is the waiting room comfortable? Is there a charging block for their phone or their family member's phone? Is there instructions on how to move through the process? And on the flip side, even afterwards, is there follow-up? So if there's prescriptions, is it easy for the patient to get prescriptions, and do they know where? Do they have a right care plan and a care package to take care of themselves afterwards? So when you think about the patient experience, there's just a number of different interactions that come into play that are outside of that medical record, and that even go on for months as you go through coding and billing and how to close out that interaction or encounter. So I'd start with getting in and doing a little immersion and journey map exercise for what it's like to be a patient. A lot of the times, a frustration or that experience is gained by the bedside manner of the physician, the nurse.
Yeah.
Did they introduce themselves? Did they set the expectation for how long the encounter is going to take? Did they set the expectation that there's going to be lab result or labs and orders as part of that interaction? So much is on the soft skill side of things when creating a total patient experience. Part of it is logging that data, but a lot of it is so personal when you get into healthcare that on the data side, we can absolutely help make that experience easier for the clinician to facilitate by helping to make sure that we can look at the patient record and it's clean and it's clear and there's quality to it. And we also have different types of either recommendations or outcome care plans that can help make that a good experience, because we want a great experience when we're seeing the physician and in the hospital. We may not want to be there. And so we've got to go a little bit further than in some other types of industries and sectors to make it comfortable. And of course, quality is on the line, to make sure that we have clear information and instructions for the patient.
Well, and you're, if I'm hearing you right, you're basically suggesting, at least at first, get your finger on the pulse, a benchmark exercise. Where are you at today? What is the experience today firsthand to the best of your ability? What is your thought on kind of collecting data around, so I kind of have two questions, like soft skills. So we do have these, nurses and others that play a critical role of kind of walking you through that process or that journey. Are there best practices on how we can collect better data around that kind of X factor of the experience?
Absolutely. So we will, and many systems will gather information about the patient experience. That's through survey. It's also through holding each other accountable as well, in that setting, and making sure that the, operating procedures of care are standardized and we're watching over each other. But from, backing into it from the data side, there's so many elements that we can capture and collect together to help clinicians and patients set the right experience, whether it is a baseline for how long an appointment is going to take, based on the markers at intake, whether it is, expectations for how long it will take to get better. A lot of times there's so much uncertainty, especially from a patient when going into a healthcare encounter or seeing a physician. The more clarity and the more expectation that we can help set based on the information we have and the baselines we can collect across the system, the better experience it's going to be. It's the surprises that are scary and cause uncertainty. And I think the data that we capture and we can present in just help that experience and make it so that expectations are easier to set and absorb.
Love it. What about, the pressure of pace? So are there quick wins that we can establish? We'll go in, we'll set some benchmarks, but hey, executives want to know quickly, right? You're used to that. You experience that. What can we go do and improve, and how much can we improve by and when, right? Results and deadlines. What's your take on some quick wins we could have?
One of the good things, I guess, when looking at quick wins is more often than not, volume exists that you can try early and fail fast. And, there's so many opportunities to try new procedures and present new sets of data in a trial format. It's being okay with letting go and saying that didn't work, or we need to try something else without penalty. And nothing around, the quality of care or the actual diagnosis. I'm talking about how a patient comes in and is presented from the system and from the office. And I think we get there early and quicker. That's the way. I don't think there's a perfect way to say that all caretakers and clinicians in hospitals should try one thing. We're getting into specialized care where different facilities see different types of populations, different types of payers, different demographics, and they need to focus on quick wins that make it better for their specific population. And it's going to be a little nuanced, and it's going to take tracking and benchmarking and a little trial and error, fail fast to make those improvements.
Okay, hopefully this is a fun question and it doesn't resurrect terrible memories of things, but I'm curious. Have you seen someone get into this kind of a role and do it poorly? Like if you were to think about the things that you should advise someone to not go do, do you have those recommendations?
To not lean in, I'll go one step further than immersing yourself as a patient. It's not connecting with the clinicians and caretakers in the system. I mean, when you are CDO in healthcare, you are a supporting role to those that are taking care of patients and that they're making those health outcomes better. You're just in a supporting role. And so the servant mindset has to be really at the front of everything you're doing. If you're trying to take over, it's probably going to be a short run. You're not going to get there. And you also just have to understand the extreme complexities and nuance that just go into some of these encounters and interactions. And it is about making it a better experience more broadly for your patients, but it also has to be specific. And so absorbing as much information about the types of care that you're providing is the one key. And so to directly answer your question, to not have that empathetic heart and side to really understand your patient population and your clinicians, I think is going to be a short run and probably a failed operation of the CDO, because you just have to be connected. Your use cases become important and how connected they are to the patient and the outcome. And if you don't focus on those types of things and iterate through, it's going to be probably not the best experience and probably not the best outcome what you're trying to achieve for the system.
Okay. So I've got one more question for you.
Go for it.
We've talked a little bit about the people and both the patients and the clinicians. We've talked about the processes, the SOPs we need to follow and be diligent, have some accountability. What about my tech stack? Like, how do I know that it's like capable of starting to do some of these things? What do I need to think about? How do I benchmark that? Is that something I ought to do?
Your physicians are going to tell you pretty early if it works. Being able to look across different stacks that exist within a system and within healthcare for continuity and governance across the data that's flowing within those systems. You'll know pretty early if you're able to match records from the point of registration all the way through to billing. And the physicians at the forefront will know very quickly and provide feedback on what's going on within the patient record and if they're talking to the right folks. And on the billing side, you'll know pretty quickly on if the information is getting to the right spot and we're sending the right bills and really closing those encounters. But I think the tech stack aside within an individual department usually is pretty functional. It's the interoperability across the whole continuum of that patient experience. And so it's the interoperability components that really become into play, and that use case for why you're connecting those data points across different systems and stacks to help support that system.
Awesome. Okay. Well, I think that you've done an excellent job in the hot seat, and I appreciate you solutioning on the spot with me.
Hey, it was great. Appreciate the time and the questions. It was a lot of fun.